My name is Peter Gorzsche. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30 or 40 warnings, contraindications, precautions, and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on. And then the patients die. That's the other half. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. So there is a huge amount of corruption. In my country, for example, Denmark, we are regarded as having very little corruption. But yet we have thousands of doctors on industry payroll, although we are just 20,000 doctors. So this is an effective kind of corruption. The drug industry buys the professors first, then chiefs of department, then other chief physicians and so on. They don't buy junior doctors. So when several thousands are on industry payroll, it's really, really bad. And that's why I wrote my book, Deadly Medicines and Organized Crime, How Big Pharma Has Corrupted Healthcare. I hope to convince patients not to take so many drugs, because so many die from the drugs they take. In my country, people take so many drugs that every single citizen can be in treatment with 1.5 drugs from they are born till they die. This is incredible. And drugs are not that helpful. And they kill very many of us. We know that. That's why drugs are the third major killer after heart disease and cancer. So what we need in the coming years is to take far fewer drugs than what we do currently. If we did that, and we